Autism spectrum disorder. Autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing problems in social interactions and communication. The disorder also includes limited and repetitive patterns of behavior. The term spectrum in autism spectrum disorder refers to the wide range of symptoms and severity. Autism spectrum disorder begins in early childhood and eventually causes problems functioning in society, socially, in school, and at work, for example. Often children show symptoms of autism within the first year. A small number of children appear to develop normally in the first year and then go through a period of regression between 18 and 24 months of age when they develop autism symptoms. Symptoms. Some children show signs of autism spectrum disorder in early infancy, such as reduced eye contact, lack of response to their name, or indifference to caregivers. Other children may develop normally for the first few months or years of life, but then suddenly become withdrawn or aggressive or lose language skills they've already acquired. Signs are usually seen by age 2 years. Each child with autism spectrum disorder is likely to have a unique pattern of behavior and level of severity, from low functioning to high functioning. A child or adult with autism spectrum disorder may have problems with social interaction and communication skills, including any of these signs. Fails to respond to his or her name or appears not to hear you at times. Resists cuddling and holding and seems to prefer playing alone, retreating into his or her own world. Has poor eye contact and lacks facial expression. Doesn't speak or has delayed speech or loses previous ability to say words or sentences. Can't start a conversation or keep one going, or only starts one to make requests or label items. Speaks with an abnormal tone or rhythm and may use a sing-song voice or robot-like speech. Repeats words or phrases verbatim but doesn't understand how to use them. Doesn't appear to understand simple questions or directions. Doesn't express emotions or feelings and appears unaware of others' feelings. Doesn't point at or bring objects to share interest. Inappropriately approaches a social interaction by being passive, aggressive, or disruptive. Has difficulty recognizing nonverbal cues such as interpreting other people's facial expressions, body postures, or tone of voice. Patterns of behavior. A child or adult with autism spectrum disorder may have limited, repetitive patterns of behavior, interests, or activities, including any of these signs. Performs repetitive movements such as rocking, spinning, or hand flapping. Performs activities that could cause self-harm such as biting or head banging. Develops specific routines or rituals and becomes disturbed at the slightest change. Has problems with coordination or has odd movement patterns such as clumsiness or walking on toes, and has odd, stiff, or exaggerated body language. Is fascinated by details of an object such as the spinning wheels of a toy car, but doesn't understand the overall purpose or function of the object. Is unusually sensitive to light, sound, or touch, yet may be indifferent to pain or temperature. Doesn't engage in imitative or make-believe play. Fixates on an object or activity with abnormal intensity or focus. Has specific food preferences such as eating only a few foods or refusing foods with a certain texture. Risk factors. The number of children diagnosed with autism spectrum disorder is rising. It's not clear whether this is due to better detection and reporting or a real increase in the number of cases, or both. Autism spectrum disorder affects children of all races and nationalities, but certain factors increase a child's risk. These may include your child's sex. Boys are about 4 times more likely to develop autism spectrum disorder than girls. Family history. Families who have one child with autism spectrum disorder have an increased risk of having another child with the disorder. It's also not uncommon for parents or relatives of a child with autism to have minor problems with social or communication skills themselves, or to engage in certain behaviors typical of the disorder. Other disorders. Children with certain medical conditions have a higher than normal risk of autism spectrum disorder or autism-like symptoms. Examples include Fragile X syndrome, an inherited disorder that causes intellectual problems, tuberous sclerosis, a condition in which benign tumors develop in the brain, and Rett syndrome, a genetic condition occurring almost exclusively in girls, which causes slowing of head growth, intellectual disability, and loss of purposeful hand use. Extremely preterm babies. Babies before 26 weeks of gestation may have a higher risk of autism spectrum disorder. Parents' ages. There may be a connection between children born to older parents and autism spectrum disorder, but more research is necessary to establish this link. Complications. Problems with social interactions, communication, and behavior can lead to problems in school and with successful learning, employment problems, inability to live independently, social isolation, stress within the family, victimization, and being bullied.